Well, I have to say that I feel like I've had a very stellar sort of introduction to the big topics in terms of politics and policy surrounding trade and health. So I'm really pleased to follow that, and I guess to be able to do something that Ron mentioned in terms of focusing now a bit more on the nitty-gritty. So kind of picking apart some of the bits of trade agreements in terms of what their implications might be for nutrition. And so this is largely based on what we've seen in the past. So I'm looking at evidence from previous liberalisation in trade and investment and the implications for nutrition that have kind of fallen out of that. So yes, it feels a bit like now for something completely different, but it's, I guess, coming back to a lot of what Sharon mentioned in terms of what this grant is about and what we're trying to understand in terms of understanding not only what might be the outcomes of the Trans-Pacific Partnership Agreement for nutrition, which Wendy will talk about later, but also trying to think about what might be policy options which are coherent between the trade and health agendas, which might help to improve the outcomes for nutrition and health for the populations in those countries involved. So I'm going to spend the first part of my presentation giving a fairly general overview of what we've seen, so what the ways are that trade can impact on population nutrition. And then in the second half, I'm going to look briefly at, within those spheres, what might be some options for intervention, because that's, I think, where the rubber hits the road in terms of trying to work together in a coherent way to come up with some possible options. So just to sort of sit this back in the frame that Sharon initiated, what we're talking about when we talk about population nutrition in this trade space is the fact that over the last, say, 40 years, we've seen this significant global dietary change. So we have seen, associated with trade, more dietary diversity, reduced food costs, which have kind of been associated with the liberalisation of trade and also general economic integration. We've also, however, seen an increased availability of cheap, convenient, unhealthy diets. So this really feeds into what Sharon highlighted in her data slides around the big health problem that's facing the world today is chronic non-communicable diseases, which in part are associated with this kind of diet. And so what we see at the, is basically a double burden of disease, which is related to a double burden of malnutrition. So the coexistence of overnutrition and undernutrition, unhealthy diets and insufficient diets, sometimes even within the same household. And the costs that are associated with this are not only borne by the health system, but also then relate to economic development, as Sharon pointed out. And they also bear significant psychosocial costs for the people involved. So that's kind of a broad frame of what I'm talking about. There are also issues around food security, which I'm unfortunately not going to go into today, but I wanted to flag as part of this bigger global dietary problem. I also wanted to highlight that this is complex, and when I'm starting to talk about what are the implications of trade policy for diets, I don't want to ignore the fact that this global dietary change that we've seen is not just about availability. I really want to emphasise that this is a complex system, as it were, of different interactions, which involves cultural change, social change, biological predispositions, as well as technological change. So I find this sort of example of that by Barry Popkin really helpful, because it really shows that the way that people eat now, the expansion of this sort of cheap, unhealthy global diet, it's not just about trade. But what I'm hoping is that, and obviously I'm a little bit biased, right? This is something I'm very interested in, but I'm hoping that by understanding how trade has maybe facilitated or interacted with these global dietary changes, we can start to effect a multi-sectoral response, so that it's not all about trade, but that trade is part of this complex system which has generated poor diets globally. So, the four different dimensions of trade liberalisation that I wanted to look at in terms of their implications for food and health First, physical trade. So as Ron mentioned and Sharon also alluded to, there's been a significant expansion in physical global trade with the reduction of particularly tariff barriers, but also non-tariff barriers to trade, really since the signing of the Marrakesh Agreement. So this has been, I think, historically a significant source of changing food environments, but it's probably becoming less of an issue because trade barriers have been so significantly reduced in terms of global dietary change. But I did want to highlight it, partly because I know as a public health nutritionist, when people think about trade and investment policy, the first thing they think about is physical trade. So I usually start there. The second issue I want to look at is agricultural export promotion and subsidy removal, which forms usually part and parcel of trade-related agreements. So in this situation, we have traditional food production replaced often by cash cropping, but also, I think, a general shift in agricultural production. The third avenue is through foreign direct investment, which Sharon gave a case study of earlier. So we've seen significant changes in the food industry globally with a consolidation and both vertical and horizontal integration of the food supply at an international level. And the fourth avenue is policy space, by which I mean reduced domestic policy capacity or autonomy to actually intervene in the food supply. So this is obviously a tailored definition in terms of public health nutrition, but policy space refers basically to the freedom, scope and mechanism that governments have at their disposal to do some form of intervention, whether that's in an economic context or in a health context. So firstly, trade in goods, which I suspect you'll be a bit more familiar with. So the first thing is that the trade that has expanded, there's been ongoing agricultural sort of commodity trade for a very long time. And what we've seen expand in this context of global dietary change has been trade in high value foods. So trade in meat, dairy, fruit and vegetables. So I'm sure you'll notice that in the temperate countries, we have this amazing array of tropical fruit that's available, and if you spend much time in tropical countries, you'll notice that there's a huge desire to consume temperate fruits. So trade sort of facilitated this homogenization of global diets in some ways. A second associated dimension of this physical trade is imports of animal feed, which has changed meat production globally. And the third issue that I wanted to highlight is this issue of dumping of commodities. So I've done a bit of work in the Pacific, and this is something that these countries really have highlighted over the last 10 to 15 years as a real problem with their food supply, where the cuts of meat that people in wealthy countries don't like to eat are exported en masse because there is no domestic market. And it becomes a bit of a tricky issue because it's difficult to tell whether this is technically dumping from a trade policy perspective, because there really isn't a domestic market for consumption of these foods. So this is just an example of some work that I did with Karuna Hawkes in Central America, looking at, with progressive liberalization in the Central American countries, this is prior to the signing of the Central American Free Trade Agreement, you can see that progressive liberalization has actually resulted in a physical change to the composition of imports. Just as reference, in these countries, liberalisation really picked up around 93, like just prior to the signing of the, prior to the establishment of the WTO. And now I want to talk a little bit about trade, food and agriculture. As I mentioned, one of the big implications of trade liberalisation is changing agricultural production. So what we've seen is this shift from, I guess, the emergence of agriculture into the formal economy. So less subsistence production, more formalised agricultural production. And this is associated with pressures externally to reduce subsidies, which have supported for small farmers perhaps. And obviously it's a complicated picture, which I'm trying to distill, but on the one level, there's this issue of a push to export agricultural commodities as a source of cash, and the reduction of subsidies, which can support traditional agricultural production and support small farmers. I also just wanted to briefly complicate the picture by using this quote, which was a guy from Samoa, and this is at the height of the global food crisis, which Ron alluded to in his presentation. And so it's not just that trade liberalisation policies have a direct effect on agricultural production, but it's also that in countries that don't have, so low and middle income countries which haven't had the extensive investment in agricultural production prior to liberalisation that the wealthy countries have had, particularly, I'm sure you'll be familiar with the US government, as this Samoan policy officer also clearly was. So a lot of the agricultural liberalisation that happened in wealthy countries came on the back of really strong domestic investment. So countries that haven't had that experience have effectively been precluded from investing in agriculture by this sort of jump straight in from subsistence agriculture to a liberalised agricultural environment. So it's a bit circular, but you can see that it's had quite a complicated trade liberalisation has had quite a complicated interaction with agricultural production. And I wanted to show this slide briefly. What I want you to look at is the paler bars, which represent the availability of the traditional, quite healthy root crops, which are have traditionally been the staple food in Pacific Island countries. And I just wanted to point out that you can really actually see this interrelationship between trade policy decisions and the agricultural production and food availability in these countries. So with a push for export promotion which kicked off in the 70s with the sort of first wave of globalisation, the first wave of maybe the second wave of globalisation, you can see the availability declined really sharply. And in the 80s, with the resurgence of sort of protectionism, the availability of these traditional healthy foods responded quite specifically to that. And then again, with liberalisation in the 90s around the WTO, the availability fell. So it's not just speculation. I just wanted to highlight that you can actually see this happening. The third avenue I wanted to discuss is foreign direct investment, and Sharon gave a really great introduction to this in terms of the fact that there's evidence that shows that increasing openness to foreign direct investment actually affects the food supply and the food availability, particularly associated with an increased availability of highly processed and quite cheap food products. And this work has mainly been done by Corinna Hawkes. I wanted to highlight, with respect to foreign direct investment, that the power that is represented by foreign direct investment in the food supply is quite significant and has increased. And so one of the concerns around FDI is not just the fact that we've seen changes to the food supply as a result of foreign direct investment expanding globally, but we've also seen an increase in the market share. So this vertical and horizontal integration of the transnational food industry. And these companies here are simply the food and beverage related companies in the top 100 transnational corporations. So 8 of the top 100 are food related. And together they're simply foreign sales, so not including domestic sales. It totals over $400 billion. So that, for instance, is more than the GDP of Thailand in that same year. So they wield quite a bit of power in this international context as well. The fourth issue is policy space, and I also wanted to highlight that this is related to the concept that Sharon also had on her slide, which I know differed slightly from mine, but she also mentioned what I would call fiscal space, which is the financial capacity of government in terms of regulation and policy making. And so that is obviously affected by trade in terms of reduction of income from tariffs, which has traditionally been a major source of income for governments of low and middle income countries. But as I said, I'm using policy space much more as meaning the freedom, the scope and the mechanisms for government to have domestic autonomy in the policies that they decide to implement. And by definition, integration into the global economy reduces that policy space. But I think what's important to note is in the face of these strong global agendas, a very strong globalised food industry, the capacity of governments to implement public health nutrition regulation, so stuff that you might be familiar with around labelling, food composition requirements, this policy capacity is related to the... It's difficult to... Sorry. It's basically the fact that government's capacity to implement those regulations, which apply to imported products and apply to the products of transnational food industry, is likely to be constrained as there's this increasing economic integration. And the Trans-Pacific Partnership, with its very strong emphasis on rights for investors, kind of represents a new dimension to that, and that's something that we'll be looking into in the grant. And these are two examples of this constraint on policy space that we've already seen in the past, so mainly related to the WTO. The first is the fact that Samoa's ban on turkey tails was overturned with their accession to the WTO. And there are definitely some caveats in this which allow Samoa to develop different regulation, but it's an obvious example of where Samoa's domestic policy autonomy has been constrained by their decision to integrate into the global economy. The second example that I have is one from Thailand, where Thailand initiated a policy to put warning labels effectively and particular nutrition information on categories of snack foods that children commonly consumed. And this was significantly delayed and also really watered down after about 4 years of discussions in WTO forums. And again, particularly the United States was quite concerned about this, being a major exporter of snack foods into the region. So now I'm going to sort of switch tack and talk a little bit about the capacity to intervene. I feel like it's quite a sort of hit the highlights overview, but I think it's important to think about some constructive ideas in terms of what we can do and not just sort of continually describe the problem endlessly. So this is the kind of framework that I'm working in. I think that when you start to think about public health nutrition in a trade policy space, there are two dimensions. One is that I think public health nutritionists, of which I'm one, need to do a bit of legwork in terms of making proposals that, to some extent at least, sit within global commitments of the countries that they work within. So issues of non-discrimination, issues of scientific justifiability and risk assessment, we need to actually do some legwork to make sure that we're doing what we can to actually engage in that space. The second dimension is to actually look at how we could potentially amend or work within trade policy making to perhaps allow some flexibilities or specific policy decisions that would help that trade policy to meet not only the stated economic goals, but also the stated sort of whole of government development goals, which include health and nutrition. So the first, I'm basically going to run through the same four sort of policy spaces, and the first one relates to trade in goods. So some of the possible ways I think that there could be stronger coherence between trade and health policy making around this sort of trade in goods and concerns by countries about unhealthy imports influencing their changing food supply. Sales ban is one, so this has been implemented and is still in existence in Fiji. The use of food standards to actually think about protecting health more than just in a communicable disease sense is another one. So Ghana has a policy limiting the percentage of fat in imported meat, and I know there's a lot of discussion around the potential to use food standards to say to reduce salt in highly processed foods on the basis of its link with hypertension and stroke. Another one is to actually think about the duty structures in countries that still have relatively high tariffs Wendy's working in Fiji, where they recently abolished the tariff on fresh fruit and vegetables based on health concerns. And the third one is this issue of taxes. So I just want to note that excise taxes, which are non-discriminatory, are compliant at a general level with trade agreements. So this is also another way to think a little bit outside the box and to think about how public health nutrition interventions can be compliant in that within the trade policy agenda. So I just wanted to, this is some work I did in Fiji looking at whether their sales ban was effective, and while there was a bit of variation in the enforcement mechanism, you can see from the bottom graph that the imports of mutton flaps into Fiji are the lowest in all the Pacific Island countries as a result of their ban. In terms of agriculture, I mean, I've thought about this a lot, but I feel like to a large extent this is something that needs to be more a compensatory policy mechanism, but that there's a lot of potential, I think, within the restrictions on subsidies to look at the possibility to support farmers, perhaps from a technical perspective. This was a paper that I wrote recently with the director of the development division at WTO, looking at whether there could be some health input into trade and agricultural policy around investments in agriculture. So I think it's one of the possible ways forward here is just to get trade, agriculture and food and health people in the same room together to think about how they might be able to achieve both economic and health goals in that agricultural space, thinking about not just agricultural production at a large scale, but actually about what is produced and what the implications for health are. In terms of FDI, because of the, I think, quite valid policy priority around non-discrimination, there's not a lot of scope to try to restrict foreign direct investment when domestic companies are producing the same foods. So the policy options that have been identified around foreign direct investment are really about managing it and to actually ensure that the public health nutrition intervention that countries might want to apply to the products of these transnational companies are clearly stated and are explicit at the point of investment to allow as much room as possible. So it's similar in some ways to the discussion around policy space, but I think this also comes into play around food security. So again, kind of this, it is a bit of a system. It interfaces with agricultural production as well. So where you have stated policy priorities around food security that mean that countries are focusing on domestic agriculture, but also potentially inviting foreign direct investors to purchase agricultural land. So it does become a bit blurry, but I just wanted to highlight it as an issue. Before discussing again, how policy space more broadly might be protected. And I've just got three broad overviews here in terms of the need to take trade commitments into account in developing public health nutrition interventions. So I know I've said this before, but I really can't stress it enough. Coming from the health sector, I think that there is a lot of legwork that can be done within the health sector to enable coherence between trade and health policy. I think it's all too easy in some respects to sort of read we should have healthy trade policy and think that then it must sit within, the responsibility must sit within the trade sector. But I think there's a lot of potential for the health sector to really speak quite constructively into that policy space. The second issue is to actually include specific text in trade and investment agreements to support public health nutrition intervention. So to remove that risk of what we've seen with the Philip Morris Asia lawsuit under the Australia-Hong Kong bilateral investment treaty, where they've actually contested plain packaging of tobacco, which is a public health measure, on the basis of it jeopardising their investment. So Peter obviously discussed that in quite a bit of detail. And the third one, I think, is basically reiterating what I said before about trying to get the different sectors into the same room. So there's been some really interesting initiatives in that space, but I don't think a lot of institutionalisation. So in Samoa, the senior nutritionist actually sat on the WTO accession committee. And while it was obviously not as successful as one might have hoped in terms of protecting the ban on turkey tails, the caveats that sit around the removal of that ban, I think, represent a real consideration and allowance for public health nutrition intervention in that space, and the time that is permitted for Samoa to slowly phase it out while developing compensatory interventions, I think is it's actually quite novel, even though it might not sound like much. So just to sum up, I wanted to highlight the fact that the ongoing investment in regional free trade and investment agreements like the TPPA might actually represent an opportunity to get health on the agenda and to engage in some of that dialogue, which is clearly already happening in those stakeholder negotiation forums. I also think that there is a growing awareness within the trade sector as health as a cross-sectoral issue, and obviously the fact that people from DFAT have taken the time to come today really underscores that. And so the capacity to get people in the same room discussing these issues and looking for constructive ways to move forward, I think represents a bit of a shift in the way that trade policy making as well as health policy making is happening. And I guess I think that as a researcher, there is also a lot of scope to look into strategies to support and enable that kind of cross-sectoral dialogue.